So many organizations are struggling with the siloed teams. I hear this quite often when I'm sitting across the table from our partners. How can compliance, coding, and clinical teams work together really in a unified workflow?
Yeah, I can take that one. So I've worked at organizations before where there were silos. And I think, in general, organizations, they don't mean to silo. It kind of happens. I think that we all have our area of focus that, we have our deadlines and we have our commitments. And I think sometimes it just happens that certain departments and teams that should really be united tend to silo. So I think it's important to identify, take a good look around your circle and say, wow, are we siloed? Did we become siloed? And if we have, what can we do to remedy that, right? And how can we eliminate that in the future? I think for us, or from my personal experience, what has worked is that understanding that there are many moving pieces, at the health plan level, not only at the health plan level, but just in all levels when it comes to the RADVs that have to be really committed to the process. It cannot be done by just one team, one department. There really does take a lot of cross collaboration. And I think it's a really good time to take a look at your policies as well and say, wow, do I have a policy to represent what happens in the event of a RADV? What needs to take place? As our compliance teams really understand the significance of what does it mean operationally. Of course, they understand the compliance of it, but the operations that take place to make a RADV happen. Are we having those conversations? How well do we know our compliance partners? I mean, that's talking about silos. I mean, I know in my organization, I make sure that these are our buddies. We're going to work together, and we want to make sure that they have an understanding of the process. So when that notification comes, that we have a policy in place that outlines what takes place from point A to point B, and again working with the data, taking a look at our the chase list, identifying the medical records. I mean, we talked about that, how important getting in the medical records, working with the coding team, making sure that the coding team is ready for that. But really the important piece is, of course, all the naming conventions that Shiva mentioned earlier, getting that. Those are little things that you don't think about, but they make a big difference and they are time consuming. And so we want to make sure that we have those policies in place, that we're ready, because I'll tell you, not being ready for these audits is probably one of the biggest pitfalls that we can do. And thinking that we got it together, thinking that, okay, having it all appear, but not writing anything down, those are mistakes. These are things that have to be well planned, well organized, well socialized amongst your peers, your community, your partners, your compliance, your leadership. Leadership, needs to understand, of course, the resources and just how many moving pieces they are. And these audits are getting shorter. I think in the day they were 24, 26 weeks, and I know that they are just significantly shorter, although I did hear they expanded it a little bit, but a lot has to be done in those few weeks. So there's no room for siloing. So really, again, my advice would be take a look. If you're not already in good communications with the teams that you will need for a RADV, I would highly suggest that you do so.